Hi everybody, it's Dr. Eric Balcavage, and today we're back for another episode of Functional Medicine Monday. And today I want to discuss how your GI tract can be causing your chronic arthritis or your chronic arthritic pain. Most times we think about joint pain and arthritis as a bony issue only, and it must be caused by something happening in the joint, or it must be a physical issue. But let me cover 5 ways that your GI tract may be at the root of your chronic arthritic pain, okay? First thing I do want to cover is, what is arthritis? Arthritis, many people think is pain that's caused by the bony change of the joint. And what arthritis really means is inflammation of the joint. So if you have inflammation in your joint, you can have pain in that joint. You don't have to have any bony change at all. And there are some people, lots of bony change or degeneration in their joint, but they don't have any pain at all. So what causes the pain in your joints is inflammation at the root, okay? So one of the first ways that your GI tract can cause arthritic pain is that there are trillions of organisms that live in your GI tract. Bacteria, viruses, yeast, parasites. These organisms live in there, and if they are in there and under control, they're not a big problem. But if there's damage to the GI tract, the bacteria and yeast, they can leave the GI tract, get into the systemic body via the bloodstream or through lymph tissue, and they can find their way to your joints. And one of the things that bacteria and yeast specifically love to feed on is joint cartilage. So when these organisms from the GI tract get into the joint tissue, they just start eating away the joint and start creating inflammation and pain. So that's way number 1 that your GI tract can cause your arthritic pain. The second is some of the bacteria in the GI tract can release toxins. They're called LPS and LTA, and these toxins can get out of the GI tract into the bloodstream and find their way to the joints and tissues and induce inflammation. And that inflammation is going to increase pain, and that's going to lead to what you perceive as arthritis. The third way is anything that causes any inflammation in the GI tract, whether it's bacterial imbalance, whether it's decreased stomach acid. There's multiple reasons that you can have increased inflammation in the GI tract. But if the inflammation occurs in the GI tract, it can trigger inflammation outside the GI tract, and that can impact your joints and tissues. The fourth is food intolerances. If you're eating foods and it's irritating or creating an immune or inflammatory reaction in your GI tract, that immune or inflammatory reaction can then trigger more inflammation inside the GI tract and then outside the GI tract, and that can damage the joint. That inflammation can also trigger immunity issues and trigger what we call autoimmune conditions that can damage the joint tissue. And the last is if you don't have a really healthy GI tract, and you may not have any symptoms of GI problems, you may not have any gas or bloating or pressure or constipation or diarrhea, but you could still have functional problems in the GI tract. And when you have functional problems within the GI tract, it can impact the absorption of key nutrients that are critical to optimal bone health and critical to reducing your systemic inflammatory load. So those are 5 ways that your GI tract can be causing your chronic arthritic pain. And if you don't address the root causes, then you're stuck using anti-inflammatory medications. And that's one of the things I really caution patients not to do too often. And I understand that you're in pain, so you want to take an anti-inflammatory medication, but taking anti-inflammatory medications on a regular basis may mitigate or reduce your pain temporarily, but in the long run, those medications prevent the tissue from actually healing and repairing. So that's one of the 2 things to do, is to reduce the amount of over-the-counter anti-inflammatory medications. The other 2 things you can do is, 1, change your diet. Start focusing on a whole food diet and a less processed food diet. Many of the processed foods we eat, they're really tasty, they're very convenient to get, but it's many of those processed foods that actually trigger the inflammation and damage in the GI tract that's at the root of chronic arthritic conditions. The second thing is, get a good functional assessment of your GI tract. And these tests can be performed by functional medicine practitioners like myself. Many times there's stool tests that can look at bacterial overgrowth, yeast overgrowth. They can identify leaky gut syndrome. They can identify inflammation in the GI tract and a number of other conditions, even like food intolerances. Okay, so hopefully this Functional Medicine Monday video helps you to some degree. If you have any questions, put your questions below wherever you watch the video, or reach out to us at the office at Rejuvigen. Take care.